Good day, everyone. For today's lecture or today's topic, we will be discussing one of the recommended vaccination for healthcare workers, which is your MMR or your mumps, rubella, and your measles vaccine. So let's discuss each diseases one by one. Just a brief discussion with regards to each infection or diseases. When we talk about measles, this is a highly contagious rash illness that is transmitted by respiratory droplets and airborne spread. Severe complications of your measles might result in death, include pneumonia and encephalitis. And your mumps, it is an acute viral infection characterized by fever and inflammation of the salivary glands, usually parotitis. The spectrum of illness ranges from subclinical infection, which accounts to 20 to 40%, to non-specific respiratory illness, sialadenitis, including classic parotitis, deafness, orchitis, and meningoencephalitis, and severity of the diseases or infection increases with age. While your rubella, it is a viral disease characterized by rash, low-grade fever, lymphadenopathy, and malaise. Transient arthralgia and arthritis are observed commonly in infected adults, particularly among post-pubertal females. These diseases can be prevented through vaccination. Now, children should get 2 doses of your MMR vaccine, starting with the first dose at 12 to 15 months of age and the second dose at 4 through 6 years of age. Teens and adults should also be up to date on their MMR vaccination. Healthcare worker who work in a medical facilities should be immune to measles, mumps, and rubella. Healthcare worker can be considered immune to measles or mumps or rubella only if they have documentation of a laboratory confirmation of disease or immunity, appropriate vaccination against measles, mumps, and rubella. Let's, for example, 2 doses of live measles and mumps vaccines given on or after the first birthday and separated by 28 days or more, and at least 1 dose of live rubella vaccine. Now, as you can see on the slide, that the first criteria is a laboratory confirmation of disease or immunity. So, history of having the disease is not part or is not one of the qualification for us to be able to say or to confirm that you already is immune or you have already acquired the disease. Okay? You should have a laboratory confirmation of the disease or immunity to measles, mumps, or rubella. Furthermore, healthcare professionals with 2 documented doses of MMR are not recommended to be serologically tested. Okay, there's no need for testing for immunity. But if they are tested and results are negative or equivocal for measles, mumps, and or rubella, these healthcare practitioners or professionals should be considered to have presumptive evidence of immunity to measles, mumps, and or rubella, and are not in need of additional MMR doses. 2 doses of MMR vaccine should be considered for unvaccinated healthcare workers born before 1957 that do not have laboratory evidence of disease or immunity to measles and or mumps. 1 dose of MMR vaccine should be considered for healthcare practitioners or professionals with no laboratory evidence of disease or immunity to rubella. For these same healthcare professionals who do not have evidence of immunity, 2 doses of MMR vaccines are recommended during an outbreak of measles or mumps, and 1 dose during an outbreak of your rubella. Now, how about for giving vaccinations to women of childbearing age? Now, these are the things that we need to consider. Women of childbearing age who are not pregnant and do not have presumptive evidence of immunity should get at least 1 dose of MMR vaccine. it is safe for breastfeeding women to receive MMR vaccination. Breastfeeding does not interfere with the response to MMR vaccine, and the baby will not be affected by the vaccine through breast milk. Now, who are this group of people or individuals who should not get MMR vaccine? First is, has any severe life-threatening allergies? A person who has ever had a life-threatening allergic reaction after a dose of your MMR vaccine or has a severe allergy to any part of this vaccine may be advised not to be vaccinated. So you need to ask your healthcare provider if you want information about vaccine components. Next is if you think or if you are pregnant or thinks she might be, if you are pregnant women should wait to get MMR vaccine until after they are no longer pregnant. Women should avoid getting pregnant for at least 1 month after getting MMR vaccine. Theoretically, the live attenuated virus in a vaccine could cross the placenta and result in viral infection of the fetus. So that is why MMR vaccine should not be administered to women known to be pregnant or attempting to become pregnant because of the theoretical risk to the fetus when the mother receives a live virus vaccine. Women should be counseled to avoid becoming pregnant for 28 days after receipt of MMR vaccine. If the vaccine is inadvertently administered to a pregnant woman or pregnancy occurs within 28 days of vaccination, she should be counseled about the theoretical risk to the fetus. Third one is has a weakened immune system due to diseases such as cancer or HIV or AIDS, or medical treatments such as radiation, immunotherapy, steroids, or chemotherapy, and has a parent, brother, or sister with a history of immune system problems, has ever had a condition that makes them bruise or bleed easily, has recently had a blood transfusion or received other blood products, you might be advised to postpone MMR vaccination for 3 months or more. When MMR and varicella vaccines are given shortly before, simultaneously with, or after an antibody-containing blood product, response to the vaccine can be diminished. The duration of inhibition of MMR and varicella vaccines is related to the dose of Ig in the product. So MMR varicella vaccine should either be administered more than or equal to 2 weeks before receipt or receive of a blood product, or should be delayed 3 to 11 months after receipt of the blood product, depending on the dose and type of blood product. Next is if you have tuberculosis, avoid getting MMR vaccine. Has gotten any other vaccines in the past 4 weeks, live vaccines given too close together might not work as well. If you are not feeling well, a mild illness such as a cold is usually not a reason to postpone vaccination. Someone who is moderately or severely ill should probably wait. Your doctor can advise you. How does our MMR vaccine work? MMR vaccine is very effective at protecting people against measles, mumps, and rubella, and preventing the complications caused by these diseases. 1 dose of our MMR vaccine is 93% effective against measles, 78% effective against mumps, and 97% effective against rubella. 2 doses of MMR vaccine are 97% effective against measles and 88% against mumps. How does our MMR vaccine work? MMR vaccine is very effective at protecting people against measles, mumps, and rubella, and preventing the complications caused by these diseases. 1 dose of our MMR vaccine is 93% effective against measles, 78% effective against mumps, and 97% effective against rubella. 2 doses of MMR vaccine are 97% effective against measles and 88% against mumps. Our MMR vaccine, or measles, mumps, and rubella vaccine, is is an attenuated, meaning to say it's a weakened live virus vaccine. This means that after injection, the viruses cause a harmless infection in the vaccinated person with very few, if any, symptoms before they are eliminated from the body. The person's immune system fights the infection caused by these weakened viruses, and immunity, the body's protection from the virus, develops. Some people who get 2 doses of MMR vaccine may still get measles, mumps, or rubella if they are exposed to the viruses that cause these diseases. Experts aren't sure why. It could be that their immune system didn't respond as well as they should have to do the vaccine, or immune system's ability to fight infection decrease over time. However, disease symptoms are generally milder in vaccinated people. Next is we are going to talk about the other recommended vaccination for healthcare workers, which is your varicella vaccine. Your chickenpox or varicella, it is a very contagious disease caused by your varicella zoster virus. VZV or your varicella zoster virus is transmitted from person to person by direct contact, inhalation of aerosols from vesicular fluid of skin lesions of varicella or herpes zoster, a localized generally painful vesicular rash commonly called shingles, or infected respiratory tract secretions that also might be aerosolized. The average incubation period is 14 to 16 days after exposure to rash, range from 10 to 21 days. Infected persons are contagious an estimated 1 to 2 days before rash onset until all lesions are crusted, typically 4 to 7 days after rash onset. Typically, primary infection with VCV results in lifetime immunity. VCV remains dormant in sensory nerve ganglia and can reactivate later, causing herpes zoster or your shingles. So how can we prevent varicella? One way of preventing is one of the best way to prevent varicella is through vaccination. CDC recommends 2 doses of chickenpox vaccine for children, adolescents, and adults. Children should receive 2 doses of the vaccine. The first dose at 12 through 15 months old and a second dose at 4 through 6 years old. 2 doses of the vaccine are about 90% effective at preventing chickenpox. So how do we know if a healthcare worker is immune already to varicella? First is there should be a documentation of 2 doses of varicella vaccine given at least 28 days apart. So documented vaccination. Second is laboratory evidence of immunity, laboratory confirmation of disease, and diagnosis of verification of a history of varicella or herpes zoster by a healthcare provider. So these are the guidelines in order for us to be able to say that a healthcare worker is already immune to varicella or chickenpox. So how long does immunity to varicella last? In clinical studies, detectable antibody levels have persisted for at least 5 years in 97% of adolescents and adults who were administered 2 doses of varicella vaccine 4 to 8 weeks apart. But boosts in antibody levels were observed following exposures to varicella, which could account for the long-term persistence of antibodies after vaccination in these studies. Is varicella vaccine safe? The varicella vaccine has an excellent safety profile. So how do we manage healthcare workers or patients who have been exposed to varicella or chickenpox? First, all exposed susceptible patients and healthcare practitioners or professionals should be identified using the criteria for evidence of immunity, as what I have mentioned, okay, on the previous slide. Post-exposure prophylaxis with vaccination or varicella zoster immunoglobulin, depending on the immune status of exposed healthcare professionals and patients without evidence of immunity, is recommended. Healthcare professionals who have received 2 doses of vaccine and who are exposed to varicella zoster virus, like varicella, disseminated herpes zoster, and uncovered lesions of a localized herpes zoster should be monitored daily during days 8 to 21 after exposure for fever, skin lesions, and systematic symptoms suggestive of varicella. Can we still get varicella even though we already received vaccination or has been vaccinated? Some people who are vaccinated against chickenpox may still get the disease. However, it is usually milder with fewer blisters and little or no fever. So that ends our discussion on the recommended vaccinations for healthcare practitioners or healthcare workers, which are your MMR and your varicella. So I hope that if you have any records of immunity that will suggest that you have been exposed to the disease before, or you are immune already to the disease or infection, or if you have any documented vaccination that you received 2 doses of your MMR or varicella, then that will be a guarantee that you are immune already to the disease. And if you can provide any evidence, as what I have mentioned, if you can provide any of those evidences to the employee health clinic, it would be better for documentation and record purposes. So the next topic that we will be discussing regarding your recommended vaccination is we have your meningococcal vaccine. And after that one, we will be discussing your work restriction as a healthcare worker. If you have any certain types of diseases or infection, how long are we going to restrict you from working, or what are certain considerations that you can do, or what are your limitations as part of your work restriction. So that ends our lecture for this day. Thank you and God bless.